Hi, I'm Dr. Robert Robinson of Urban Housecall.
And I'm Dr. Carla Robinson, and this is your Urban Housecall Doctor's Note of the Day. Are you a woman ready to take control of your health, but you're just not quite sure where to start?
Or maybe you're a man and you've not been to the doctor in 15 years or more and don't know what to expect. This is a step-by-step guide as to what test you should be getting based on age to make sure you're as healthy as you can be. Fellas, if you're at least 18 or older, you definitely need to have a blood pressure screening each year. Once you're in your 30s, add to that at least one cholesterol screening every 5 years to make sure you aren't at increased risk of heart disease. Once you hit 40, it's time to add a yearly prostate exam. Prostate cancer tends to strike Black men at earlier ages, and therefore, it's a good idea to begin screenings 10 years earlier than men in other racial groups.
Ladies, if you are 21 years or older, it's recommended that you have a yearly well-woman pelvic exam and a pap smear every 3 years to screen for cervical cancer. In your 30s, you too need at least one cholesterol screening every 5 years to make sure you aren't at increased risk of heart disease. Once you reach 40, it's important to begin yearly mammograms as a screening for breast cancer.
At age 50, everyone needs to have screening colonoscopy to detect for any signs of colon cancer. Colon cancer is highly treatable when it's detected early. Therefore, screening before any symptoms develop is essential to the best chances of survival.
There are a few other tests that aren't age-based, but need to be done on a regular basis to ensure you are in your best health. These include the Complete Blood Count, or CBC. This important test is useful in screening for anemia, infection, inflammation, and other blood disorders.
Next, the Thyroid Screen, or TSH. This screening test is a measure of the health of the thyroid gland. The thyroid gland is responsible for regulating the metabolism in the body, and, if diseased, can lead to many symptoms, including weight changes, mood changes, neck fullness, fatigue, anxiety, heart rate disturbances, and skin and hair changes.
Next, vitamin D screening. Normal vitamin D levels are thought to be helpful in protecting against high blood pressure, diabetes, certain cancers, multiple sclerosis, and other autoimmune diseases. The end of a year and the beginning of a new one oftentimes means a renewed commitment to faith, family, and personal goals. This year, make sure your health tops the list of priorities and make it your healthiest year yet. I'm Dr. Carla.
And I'm Dr. Rob, and this has been your Urban Housecall Doctor's Note of the Day. Until next time, remember,
It's a health thing. We've got to understand.